I'm here with Jim Eichenlaub. He's the executive director of the Builders Association of Metropolitan Pittsburgh. Can you tell us a little bit about your organization and what you do?
Sure. The association was created in 1938 at the time of the Depression and the rise of government regulation. The small businesses decided that they felt they needed a voice in government, and they created, at that time, the Home Builders Association of Allegheny County. We've since have grown over the years and now represent basically the counties in southwestern Pennsylvania. We are affiliated with the National Association of Home Builders and the Pennsylvania Builders Association. The association is made up of home builders, remodelers, subcontractors, suppliers, all of those companies that are involved in the housing industry, apartment owners, and right now it consists of a little over 600 companies.
So how have those businesses been affected by the COVID-19 pandemic?
It's been a struggle. Pennsylvania was one of only two, then maybe three states that shut down construction during the blanket shutdown orders, which was surprising to us. And obviously we tried to convince the governor's office that we were a life-sustaining business, providing housing and shelter to those who need to shelter in place, obviously is an important business. Later on, in late March, the federal government Department of Homeland Security also recognized that we are an essential business, but we were closed until the governor's order on May the 1st. Subsequent to that, of course, on May 15th, our region went to yellow, which did not loosen the restrictions or guidance that was placed upon construction in the initial May 1st start order.
What have the biggest concerns been from the members of your association?
Obviously, like any small business or any other businesses that were shut down, but more importantly for us was that we had customers who were expecting and needing shelter, and that shelter was pulled out from underneath them and stopped. We did have members who applied for waivers. Some got it, some didn't. And then at the end of March, all those waivers were pulled, and with additional guidance that basically said that for residential construction and construction, we weren't allowed to operate except for emergency repairs and when the building was substantially completed, which was when the occupancy permit was issued. Frankly, when an occupancy permit is issued, that means that the building is done. But we had consumers and homeowners being forced to move into temporary housing because they had sold their house and they were expecting to move into that home. And of course, but for all intents and purposes, construction ceased at the middle of March.
Now, what support and resources have you been offering to your members to help support them during this really difficult time and this time where we don't know what's going to happen with their businesses at the moment?
Well, certainly we've been providing them with all the information as it comes out of the state in the federal government in regards to business operations, PPPs, and so on. But we were also very instrumental for instance, at the national level. They're head of what's called the Construction Industry Safety Coalition. And they were the folks who developed the general guidelines, safety guidelines for operation under COVID-19. That along with providing constant information about where we were, how our efforts were, in working with the administration to convince them to lift the restriction on construction. And then once that was done, also continued to try to provide clarification, educate the administration on how construction actually operates, how it works, and did receive some clarification regarding workers inside the house and workers outside the house, the calculations of that, how many workers, the difference between a single family detached home versus building a townhouse or duplex, those sort of things. So we've sent out 35, 40 email communications, plus we have a resource on our website, pghhomebuilders.com, as well. And that's similar to what our state was doing and what our national association was doing. But we've been a resource in all sorts of ways to help them get through this and then prepare once they did operate, how they could do it safely to protect not only the workers but the public.
Now, earlier this month, I believe on May 13th, you filed an emergency petition. Can you talk a little bit about that and why you decided to file this?
One of the most disturbing facts of the May 1st order, the governor's order, was that while construction is generally treated as a single class, the Department of Homeland Security recognizes construction in that way. The Occupational Safety Administration, OSHA, looks at it as a single entity. The Construction Safety Coalition designed its guidelines as such. But when the order came out, it said that for residential construction, the home builders were limited to 4 workers on a house building the home. Commercially, they were permitted 4 workers for the first 2,000 square feet, and then an additional worker for every 500 square feet after that. So, for instance, if I'm building a 3,500 square foot convenience store, I could have 7 workers on that site. But if I'm building a 3,500 square foot single family home, I'm limited still to only 4 people. Certainly we can socially distance just as easily, if not better, in a 3-story building where we could have workers on the base, working in the basement and working on the 2nd or 3rd floor. And the problem with that is, frankly, you can't build with 4 people in many instances. It can be unsafe. It can also be, so what this is doing is artificially delaying the progress of building that home and further delaying our ability to deliver that home on a timely fashion that those customers expect.
Why was this guidance put out between residential and commercial construction projects?
Well, it's the same guidance, except for this definition and this issue alone. We still have to do the exact same things in the safety protocols: wearing the masks, not sharing tools, sanitizing, all of those things that, frankly, the guidance is very similar to the sample guidance that was developed by the Safety Industry Coalition. In the governor's press release, he referenced the General Contractors Association and working with him, but the GCA are members of this coalition, so I'm assuming that's how the basic documents. So we still to this day don't know why the cap on residential is treated differently. So the lawsuit, frankly, is a challenge under the Equal Protection Clause. Construction is construction, and we are considered the same class, but yet for some reason the administration, the guidance split the two, and the only difference in the guidance is the definition of what is construction for residential and what is construction for commercial.
And where are you in the process of this lawsuit?
We filed the petition, as you said, last week. We're actually amending it. A few of our members asked to be placed on the complaint as individual companies. And we're waiting to hear. We have not heard a response from the administration or his attorneys, which we assume will be the Attorney General's office. There's usually a time, allotted for them to respond to the complaint, so we haven't heard anything. We're still hopeful, of course, that the administration will recognize how this is done. I mean, when you build a home, people have to understand, it usually takes about 25 different companies that are involved in it one form or fashion. And it's very important when you get inside the home, especially when you're dealing with the mechanicals. So you need the plumber there along with the HVAC company or the electrician, because they're all fighting for the same space inside the walls. And, if I'm installing, we could first move it along faster, but also sometimes they need to coordinate that. And it's hard to do it when you say, okay, you can come in today, and then the next person comes in tomorrow, and so on and so forth. It just is unruly, impractical. And frankly, we see the numbers of the number of cases in our region and across the state. They are dropping. We've seen, a marked decrease since we opened up on May 1st. We saw a drop from the 2 weeks, April 15th to the end of the month as well, but we're still seeing a continued decrease. And the cases that are being reported are in nursing homes in those areas, and we're not working in those areas. And so, we feel that, that relief should be there. What further exacerbated the problem for us was that because construction was open across the state, red, yellow, whatever. There were no other additional allowances or means. The guidance was the guidance, and his yellow declaration said that stays, that remains. So, again, we feel that our members' rights under the Equal Protection Clause have been violated. All the waivers were pulled, all the waivers were wiped out. And so, aside from due process, but to us, it's the most important thing is we want to be treated the same. The calculations are, I don't understand the calculations, frankly, of not only residential, but the one per extra. I assume that they're assuming that, workers need to socially distance. These are men and women or adults, they're trades, they're used to working outside or in open air. They're used to working under safety protocols that have been in place for OSHA. This is just an added protocol. One of the funny ones, my member said, Jim, we have to increase our portage on cleaning to twice a week, which are generally, once a week jobs, and assuming, 10 to 25 workers. And now we're doing it twice a week for 4. A lot of it, there's no common sense. And when we've tried to explain, our cabinet makers are still shut down in many areas. Our supply chains have been disrupted still. The thing is, what people have to understand is in most depressions or downturns, it's housing that brings us out of these downturns. Consumers are, the consumer products that are bought, the homes, the number of workers because of the number of businesses that we have. Traditionally, housing brings us out of this, economic downturn. We've been shut down, we've been forced down, and now even as we're coming out of it, we're still being repressed. And it's frankly doesn't make sense because we can work safely. Our members know how to do this. We just want the ability to do it so we can deliver the product that our customers deserve and expect.
And Jim, one final question. What would you like to see from the governor and his administration for the reopening of the construction industry?
An immediate withdrawal of the cap on residential construction. We also would like to see perhaps, again, we don't know what's going to happen in Green, but we want to be able to deliver those products on a timely basis, and we'd like to get back to normal as quickly as we can. But if he fixes this and pulls back on this cap, we'll drop the lawsuit because we're then treated the same as commercial. But until then, we're going to continue to press this matter forward.
Jim Eichenlaub, thank you so much for your time.
Thank you. Appreciate the opportunity.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Matt Bellis, the spokesperson and founder of Reopen PA. Matt, can you tell us a little bit about your organization and what you guys do?
Well, Reopen PA was started April 13th of 2020, really to try and understand as citizens how the reopening process was going to happen. And we wanted to get more information about what was going on. I don't know if you remember, but there wasn't a whole lot of information coming out from Harrisburg about what it would mean for the individual communities to start to reopen. And so we got together, some friends of ours, to see how this was going to happen. After contacting some senators and representatives in the General Assembly and trying to figure out what was going to be happening, we started to realize that the reopen phase might be a little bit more difficult than anticipated. So we felt the need to grow a big movement of people who really wanted to see some change and some real information and science and data and metrics come out from Harrisburg about how this whole process was going to happen.
Now, what has the goal and vision been of Reopen PA for how you would like to see the reopening process here in the state?
Well, we distilled it down to three basic areas where we wanted to see the vulnerable be protected. We knew, of course, that COVID-19 is a real disease, and it does affect people who are vulnerable, have comorbidities, who are elderly. And so we want to make sure that we can do what we can to protect those who might be at risk. We also wanted to open the economy. That was, of course, a main goal. We saw a lot of businesses and people who are out of work, people who wanted to get back to work, and we wanted to be able to open the economy as well, and as a main goal. Our third point was really, though, we wanted to champion liberty. And we really truly felt that you can protect the vulnerable, open the economy, all while respecting individual people's liberties and not trample on them and try to force them into decisions that they didn't want to make. So those were the basic goals of Reopen PA, and we're still working on those, wanting them to happen. We're trying to do what we can to make our position known, but as a group, it's not a partisan issue. This is both and. This is left and right, Republicans, Democrats, everybody within a grassroots movement coming together to understand how we're going to responsibly reopen the state.
Now, as our counties are shut down, businesses are closed, people aren't really going out, how has Reopen PA organized and how have you really come together to help make this organization come alive?
A lot like we're doing right now. It's been online word of mouth, and we've had a Facebook group. We've got over, I think, 95,000 members now who are committed to reopening the state. It's been very much a grassroots movement. I'm not paid to do this. Nobody is paid to do this. We have people who are donating time and effort and resources and services to make this happen. This truly is a response of the people of Pennsylvania coming together to try to do what we can to reopen the state.
Now, Reopen PA has had 2 rallies at the state capitol complex. Can you talk a little bit about those rallies and why you were at the state capitol?
The first one really was a response to the fact that we didn't get a whole lot of information coming from the governor about reopening. It really was to get basically his attention, to let him know that people wanted to reopen the state. The second one really, though, was in response to the fact that the governor had taken upon himself, special powers afforded by a particular law that was meant for disaster relief, took on these powers by an executive order to really guide and determine by himself what the state was going to be doing. And so having those special powers, we felt was a little bit of an overreach on his part. We felt that it was necessary for him to be working with our duly elected representatives within the General Assembly. So we wanted to see what the governor could do to work with the General Assembly again, and that's why we had the protest on May 15th, to tell the governor to give up these special powers and work with the General Assembly again. Unfortunately, he decided to ignore that, has not done so. I think has proven even since then to really want to almost ignore the General Assembly. You saw him veto a number of bills yesterday and then make a special decree about reopening real estate offices. So we're really confused. It's a time that we're not sure exactly what's going to be happening. This is a representative commonwealth. We didn't start this as a way to be, the state wasn't started to be dictated to by one person. This was everybody being a part of the community, and we just don't have that right now.
Have you had any major disagreements with the way that Governor Wolf is deciding to reopen Pennsylvania, or how that information is getting to citizens here in the state?
Well, we saw that plan that he put out, which was red, yellow, green, and even in trying to ask what does it take to get to the green stage, and we haven't really even heard that much about it. Some counties have moved to yellow. Some say that they've already meet the requirements to move to yellow, so they're going to do it anyways. I actually live in one of those counties of Lancaster. And so we're just in a state where we're just confused about what all of these things mean, what the data is being used to justify these moves, and really the actions that the governor has taken, especially when it comes to nursing facilities, having them take on COVID patients, which resulted, unfortunately, in the deaths of many people. So really, we don't have a whole lot of confidence. He says that he wants open and transparent decisions to be made. He wants this to be a conversation with all of Pennsylvania. But frankly, his actions prove that that's not the case.
So what things would you like to see from Governor Wolf, from the health secretary, from the Wolf administration during this time of pandemic and his response to it?
At this time, we believe that his decision-making ability is either compromised or not trustworthy. So we would like him to give up the emergency declaration powers that he has taken on himself. Don't renew anything. Give them up today and work with the General Assembly again. Those are the people that that you and I elected to represent us within the State House, and he needs to open up those lines of communications again and let that whole process of reopening the state work through the General Assembly rather than just one person. We need an entire community effort here. We can't be dictated to by fiat.
What ways would you like to see the legislature work with the governor, and what type of legislation would you like to see to help reopen Pennsylvania's economy?
Well, we've already seen some bills that are, I think they're still currently in play when it comes to reopening the economy. There was, I do have some notes that I took a little while ago. House Resolution 836 and Senate Resolution 323. Those were put out there by Representative Russ Diamond and Senator Doug Mastriano. I think those are still in play, but they haven't gone anywhere. It really hasn't been decided upon by the governor. And frankly, I think the governor needs to realize that he needs to step back, work with the General Assembly again, start reopening the state. We can do these things safely, and we don't need to be in a position where our rights and liberties are trampled on just to try and justify a way to keep people safe from COVID-19. Because frankly, I don't see a whole lot of people being safe from COVID-19 at the moment.
Now, there are some people who say that the business closures and the county shutdowns have been helpful in stopping the spread of COVID-19. What would you say to that argument?
Well, we spoke to an epidemiologist a few weeks ago. She works out of D.C., and she actually said in the beginning of this thing, we didn't have a whole lot of information. Not a lot of data was coming in about the coronavirus, and so a shutdown seemed to be the wisest move. But like her and others as well, Dr. Stephen Shapiro out of UPMC have actually said keeping people in place is probably doing more damage than good. And we've heard it before, and the truth of the matter is we haven't really been able to see it, but the whole idea of herd immunity coming together really hasn't been tested in the States. It's been seen to be effective in other areas, but would love to know what that looks like here. So I don't think reopening will be detrimental to people's health. I do understand that there was a desire for all of us to try to come together to try and take care of these things in a way that wouldn't overload the hospitals. But we haven't overloaded the hospitals. Many hospitals are empty. Many wings are empty and doctors and nurses are furloughed. And so we have the ability to manage this disease. We have the ability to take care of people who have it. And I think people need to have the freedom to be able to move about again, to reopen their businesses so that we have an economy to actually take care of this pandemic. I've said it before, and I'll say it again. You don't tie your hands when you're fighting a war, and you shouldn't have to lock down an economy to fight a pandemic.
Now, as Pennsylvania's economy slowly reopens, as counties are beginning to reopen, how can Pennsylvanians keep themselves safe during this pandemic?
Well, again, I'm not an expert, and I can only say what the experts have told us. But it is the general things that you can do to keep safe. Wash your hands. Make sure you're doing it for 20 minutes. Try and keep your distance. A lot of people want to wear masks. Some don't. There's science on both sides to the issue. But really, we as individuals have to recognize that COVID-19 is a thing. It's a force to be reckoned with. It is here. We're not going to be getting rid of it anytime soon. We still have the Spanish flu from 1918. So it's something that we just need to be able to manage, and we can better manage it whenever we have an open economy rather than locking everything down.
Matt Bellis, thank you so much for your time.
Thank you.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Dr. Tracey Conti. She is the president of the Pennsylvania Academy of Family Physicians. Tracey, can you tell us a little bit about the organization and what you guys do?
Yeah, thank you. First, thank you for having us, and I'm really glad that we have an opportunity to talk about what we're doing. So the Pennsylvania Academy of Family Physicians is an organization that serves over 5,000 members in the state. We have resident members, student members, as physician members, all pursuing advocacy, education, and patient care to improve health across the Commonwealth.
So how many members do you have in your organization, and how are they being affected by the pandemic?
Yeah, so there, with everyone included, there's over 5,000 members. This pandemic is new to all of us. And so for students, it has certainly interrupted their education. They have not been on clinical sites. And so trying to make sure that we as physicians are helping them pursue their education. For our residents, they have been directly involved with patients face-to-face, both in the inpatient setting and the outpatient setting, and having them learn about how to protect themselves, as well as having them learn how to decrease spread of COVID among patients has been paramount in their education. And then for physicians, changing our practice. The adoption of telemedicine has been huge across the state, especially for primary care physicians, in particular family medicine, changing from having all of our patients come into the office to be able to have access and outreach to them in their homes. One, serving the public by decreasing the chance of spread, and two, by ensuring their patients are still receiving the necessary care in order to continue to remain healthy during this time.
Now, you're also a physician, so what have been your biggest concerns during this pandemic, and what are the concerns that you've been hearing from your members?
Yeah, so the biggest concern is making sure that we have adequate outreach to our patients to continue their health. Again, even in a pandemic, there are still things like diabetes and hypertension and well-child visits and immunizations that we want to ensure that our patients are receiving those services, but receiving them safely. So telemedicine really has been a key in helping to do that. The government has allowed us to do audio-only televisit calls as well as video televisit calls. Early on in the pandemic, that was really a concern because there was a discrepancy between payment for those models, even though the access and outreach were the same. That has since been corrected, and I think has given a lot of family medicine physicians the assurance that we can care for our patients regardless of how they're able to contact us. When you think about telemedicine, that also brings up disparities because not everywhere in the state are Wi-Fi and broadband access the same. And so those things need to be addressed as we move into this telemedicine world.
And what resources is your organization offering to your members, the students, the residents, the physicians, to help support them during this pandemic?
We have been doing a lot of advocacy directly with the legislation, including those telemedicine payment parities, trying to make sure that there are liability parity addressed to ensure that during this time of COVID, that our physicians weren't held liable for treating COVID in this new pandemic and when there's no real treatments available. We've been able to do weekly outreach for wellness for our physicians. It's called Wellness Wednesdays because in this time of social isolation, it's so important to feel connected. We've done a lot of publications, just getting the message out there to make sure that our students, our residents, and our physicians know that they're not alone and we're here for them. We actually have a dedicated COVID-19 page on our website that members can access so that they have links available to state resources and to national resources.
Now, you recently wrote an open letter to Governor Wolf and to Lieutenant Governor Fetterman. Can you tell us a little bit about that letter, what you wrote, and why you wrote it?
Yeah, so we wrote that letter to address health in all policies. What COVID has done was really shine a light on the health disparities that are across the nation, but also in our state. And it's important that we recognize that health does not live in a bubble and that access to health care requires so many things surrounding it, looking at the environment, looking at school, looking at the resources that are available to a particular person. And so while COVID shined a light on the health disparities in our communities, it was not the cause of it. And we want to make sure that there are policies and legislations intact so that we can ensure that these health disparities are really going to be looked at in the long run and we can really make an impact on health care for all.
So you mentioned health in all policies. Can you tell us what that is and how that would affect the healthcare system and how people are treated?
Right. So we really have asked the governor to convene a larger group so that we are looking at things not just related to health care directly, but asking them to get the Department of Education involved, asking them to get the Department of Agriculture involved, the Department of Energy, so that we can address all issues related to health, that we are working together in a group to address health, because we know, again, that health is more than just the physician and the patient partnership. It's everything that goes into that partnership, and where a person lives, what access they have, what access to food they have, their housing, all has outcomes in their health. And it's the social determinants of health that really make up those qualities that will relate to how someone has an outcome or how their health is improved in the long run.
What do you see this policy looking like were it to take effect here in the state?
I really see a lot of agencies coming together to address health as a whole versus an independent factor in someone's health outcome.
What have your thoughts been on the health secretaries and the governor's guidances and their conferences about COVID-19 and their response to it overall?
So we've been working very closely in sending out legislation. We're very happy with the resources they have been able to give us. We know that they are a partner in this with all of us. And with the uncertainties of COVID, and as we are learning every day, we see them addressing it. I think it's been very helpful to have that open dialogue with them.
What more would you like to see from them in their response, if anything, and what things have been most helpful for your organization to help your members?
I think their willingness to listen has been very helpful. I would like to see them continuing to do debriefings and letting us know what's going on with our state. I think they're addressing the PPE issues and the testing issues and working with communities to increase that has been very helpful.
Now, how do you think that our government administration and the community at large can work together to help keep our healthcare workers safe? They are on the front lines of this pandemic. How do we keep them safe?
So as we start to reopen, to continue to follow all of the healthcare advice of still continuing to social distance, to still continue to wear masks. We know that we are not over the crest of COVID and we're still continuing to work through it. Call your doctor. Make sure that you stay in touch with your physician so that we can have an impact of your health. that continuity of care relationship is so important in this time. We really want to make sure that patients don't neglect their health or feel scared to seek health care. We are here, we are open and accessible. We want to make sure that they are utilizing our services to continue to have good health.
And what are the ways that people here in Pennsylvania can keep themselves safe as the economy is starting to reopen, as businesses are starting to reopen?
All those social distancing techniques that people are talking about, continue to wash your hands or use hand sanitizer, continue to mask as the state reopens, are all going to be important things to make sure that we are enhancing our health and decreasing the spread of COVID, and also reaching out to their physicians to continue to keep contact and continue to keep well.
Dr. Tracey, continue.
Sorry, I was just going to say, we want to make sure that if somebody is symptomatic, that they call their doctor so they can talk to them and find out what's the best way to seek care versus going into the doctor's office with a fever or with a cough.
Dr. Tracey Conti, thank you so much for your time.
Thank you.